Okay, so Assalamualaikum warahmatullahi wabarakatuh. We are in the third part of the lecture, which is slightly different from the one before. This is entitled Refractive Errors. Okay, so refractive errors is rabun. Rabun in Malay is called rabun. Okay, so we start with understanding what is accommodation. So what is accommodation? It is a dynamic process wherein the converging power of the lens is increased by contraction of ciliary muscle, so as to bring the diverging rays of light from a near object after refraction through the eye to a point focused on the retina. Okay, so what does it mean? It means that it's actually converging power of the lens, meaning the lens will enlarge so that the light from far, when enters the lens, it will refract it near to a near point. Okay, meaning it's like focusing. Basically, it's zooming, focusing. So when we look at infinity, the ciliary muscle is at rest, so the zonules of the lens remain stretched and the lens remain flat. Okay, the lens remain flat. However, when we look near, the ciliary muscle will contract and the zonules will become loose. As the zonule become loose, the lens will bulge, okay, due to the elasticity of the capsule and the plasticity of the lens fibers. The lens will bulge, thus the power increases. So this is basically accommodation. Okay, so this is when you look at far, this is when you look at near. So when you look at near, the ciliary muscle contract. As it contracts, the zonules become loose. So the lens ciliary muscle will contract, the zonule become loose, so the lens bulge. This one terbalik lah. This one is ciliary muscles relax, the zonule bends, and the lens will become flat. So this one will focus the light nearer, this one will focus the light further. Okay, so this is what happens during an accommodation, right? So accommodation is maximum in children, and as the age advances, it weakens up, and it will end up in presbyopia by the age of 40. Okay, that's why children can see very near. They usually come to your face when they want to look at you. But as you grow older, you can see that the reading point gets further and further away because of this muscle. The muscle is already stiff and the lens cannot really bulge so much. Okay, so the accommodation at 6 years old is 14 diopter. 14 diopter is very high, and at 40 years old it's probably left at 2 to 3 diopter, and at 60 it's probably less than that. Okay, so the near point of the eye with maximum accommodation, the nearest point from the eye at which the object can be seen clearly is called the near point of the eye, meaning how far you can read. Okay, so how about the far point of the eye? The far point is the furthest point of the eye which objects can be seen clearly without accommodation. Okay, so as you can see, when the ciliary muscle contracts, the lens bulges. So in what condition usually this happens? It happens when you are reading. Okay, when you are reading, when you look at the phone. Nowadays, people look at the phone, look at the computer is not too bad. I think the phone is very near. So everything, the muscle contracts. The muscle contracts, the lens bulges. Okay, because of the muscle contracts, the muscle can get tired easily. Okay, so this, so if you want to relax your eyes, you must look far. After you read, it was recommended that after reading for 20 minutes, you must rest. 20 seconds, look at 20 meters, something, 20, 20, 20 rule. Okay, next we go on to presbyopia. Presbyopia is actually Rabun tool, whereby old people will say, "Doctor, I cannot see near. Uh, I can see far. Okay, when I want to read the Quran, I cannot read." Okay, so it is actually a condition in which the near point of the eye has receded from comfortable reading distance, so that the near visions become poor. So what do they need is that they need glasses, reading glasses. Okay, we have known before that accommodation is maximum in childhood. As age advances, the lens becomes harder, the ciliary muscles become weaker. Okay, the lens becomes harder and thick. Okay, thus the near point starts receding from the eye. Okay, because the muscle becomes stiff already. Okay. Therefore, it's not a refractive, not exactly a refractive error, but it's an aging process. So the symptoms usually unable to read near, and eye strain, headache, blurry when after they read for quite some time, when they see far, it becomes blurry, pain around the eyebrow. These are called astigmatisme. So how do you manage the presbyopia? Okay, so you give them convex lenses in the form of bifocal glasses. The rule of thumb: 40 years old, +1 diopter. But for near, this is for near vision only. 50 years old +2 diopter for near work, and at 60 years old is +3 for near work. Okay, so you give them always give them glasses first, multifocal glasses or bifocal contact lens, and last was multifocal intraocular lenses after the cataract surgery. But some people also will advise LASIK for these people. Okay, next the most common type of refractive error is myopia. Well, I guess more than 50% of the medical students are all myopic. Okay, where it is a refractive error wherein the parallel ray of light coming from infinity of the refraction to the eye come to a point focus in front of the retina when the accommodation is addressed. Instead of being focused at the retina, it is being focused in front of the retina because of few factors: long eyeball, let's see. So these are the etiology of myopia, which is the axial myopia. Axial myopia is because of the long eyeball. Curvature myopia is because of the extremely curved cornea. For example, in keratoconus. Index myopia is because of the lens, very thick, and or perhaps some trauma, anterior dislocation of the lens, either traumatic or it can also be spontaneous. So if the lens comes forward, of course the focus also becomes forward. So when the focus is here, so the image that falls on the retina will be very blurred. Okay, so this is an example of curvature myopia. So what are the symptoms? It's deflective distant vision, unable to see distance. Saya boleh tengok jauh tapi saya tak boleh tengok dekat. And they can have floaters. Myopic people, very common, they can see floaters when they read, or especially when they drive. They can start as early as 20s. Defective central field or sometimes peripheral visual field, but this is quite rare. Okay, so the findings, when you look at the fundus, large optic disc, temporal myopic crescent, white patches of choroidal atrophy, lattice degeneration. This is an example of myopic crescent. This is the optic disc. You look at the fundus, you can see all the blood vessels, choroidal blood vessels. This is the retina vessels. This is the one behind that looks like a tiger's pattern is called the tigroid. This fundus is called tigroid fundus, or you can see tessellated fundus. So this is common in myopic eyes. Why is it like this? Because the eyeball is very long and the eye is very big, so the retina is being stretched, becomes thin, so you can see the choroidal shadows very easily. This is an exaggeration of the myopic crescent. Also, this is actually choroideremia, not in myopic eyes. It's not normal. So these are just patches, choroidal patches. Okay, so it is also common to see a very small uptick in myopic eyes, small and tilted. So this is the retinal vessel. So when we say vessel, we ask you to look at the vessel. We are referring to the retinal vessel, artery and vein. But when we are talking, when we say this tigroid fundus, we are referring to the choroidal vessel. Okay, so what are the complications of myopia? You can have retinal detachment. If you go into cataract surgery, the cataract surgery won't be easy. You can easily go into complication. And myopia is also associated with open angle myopia. So what are the treatments? It's always start with the non-invasive treatment, which is concave lens, you give contact lens, and however, there are also surgical treatment for myopia, which is photoradial keratotomy. PRK is rarely used now because it can cause scarring. LASIK, okay, clear or very advanced, very invasive, which is clear lens extraction, which is rarely done. Most people go for glasses and LASIK nowadays. Okay, so so what type of glasses do you use? You use a concave lens. Why do you use concave lens? Because you want the light to fall further. Want the light to fall further from the retina. Okay, so that it can be focused on to the retina rather than in the middle of the retina. Okay, so all right. So next is hypermetropia. So which is a refractive error wherein the lights come to a point focused behind the retina. Okay, instead of being focused in the middle of the retina, and like myopia, the light is being focused further away. So there must be a few factors involved. Okay, so axial myopia, it refers to the short eyeball. Curvature hypermetropia because of the flat cornea. Index hypermetropia, it refers to the lens, which is very thin, and abnormal position of the lens. This is probably because of spontaneous dislocation, posterior dislocation, or even because of trauma. Okay, so you see the focus is here, it should be here, right? So the features, it's a defective near vision. Patient cannot see near. Accommodative eye strain. When they read books, they feel headache. Some children can even have vomiting. And accommodative esotropia. This is in children. When they read, their eyes turn in, then they become squinted. Okay, so every children with squint vision should be referred for glasses. Must be referred for glasses. Any squint must be referred for glasses because most of the time it can be corrected. Okay, so the pathology is on the anterior segment is a small eyeball, shallow anterior chamber, which is the risk of angle closure glaucoma. Okay, okay, and clinically you will see a very small disc, increased reflexes of the fundus background. The fundus is very nice, it's very orange, you cannot even see the choroidal shadow behind it, all orange and nice, just like your textbook pictures. Okay, so how do you treat? You treat with convex lens, spectacle, contact lens surgery, and also you can take out the lens, right? Okay, the final type of refractive error is astigmatism, whereby it does not come to a point of focus on the retina at all. A refractive error wherein parallel rays of light coming from the infinity after refraction through the eye do not come to a point focus on the retina. Okay, it does not. Where's the picture? Oh my God, there's supposed to be a picture here. Never mind. Okay, so instead of being focused here in hypermetropia and being focused here in myopia, in astigmatism, the focusing is somewhere here and here, and it's actually because of multiple factors. Okay, it can be because of corneal irregularity. This one is, it can be either congenital or can be acquired. Okay, congenital, you were born with astigmatism, you were born with irregular cornea, or acquired because of post-operative. Probably there's stitches on the cornea. Of course, it will cause some distortion, corneal scarring, pterygium, callation. Okay, it all gives some dents on the cornea. So therefore, the focusing is breaking. Okay, how about lens? A lens abnormality can be due to congenital or can also be due to acquired. So it can be also congenital subluxation or lenticonus. Lenticonus is where the lens has some bulging, and also because of acquired. Okay, and it acquired subluxation due to trauma. So how do you treat astigmatism? You give them cylindrical lens or contact lens or toric lenses. Take out the crystalline lens and you put in toric lenses, or you can also give the LASIK option to the patient. Okay, I think I will upload the picture in the Google Classroom for the astigmatism. All right, I think that's about it. We will see you again in next lecture. Thank you. Bye.